All right. Let me make sure I'm recording. Hi, good morning, everyone. I'm Marcia Hovey, the Executive Director of Cadre, and I want to welcome you today to our presentation, How Cold Is It? It's cold enough to have a serious discussion about shelter planning. So how cold is it? We decided to do this presentation. I was working with the Office of Supportive Housing right at the end of summer when we were having a lot of cooling centers. I spoke with Kathleen Conley and we decided that we needed to do one for warm weather or warming centers as well, just to continue to have this conversation about what we're supposed to be doing when the temperatures are too hot or too cold to protect the lives and property and environment that our local governments are tasked in all of their emergency plans. That is their role. And how nonprofits can play a role in that to either ease the burden or just partner to make it more successful. So today we're going to look at what some of the existing programs, talk about the methods of coordination, identify any planning gaps, capture participant thoughts and any additional resources, and explore opportunities for collaboration. We have 4 speakers today. Beatrice Ramos, who's the VP of Emergency Housing Programs for Home First. Kathleen Connolly from the Office of Supportive Housing, Senior Emergency Planning Coordinator. City of Morgan Hill, Rebecca Garcia, Housing Director. And the City of Sunnyvale, Terry Silva, who's the Assistant City Manager. And they have done quite a bit of work in the area of sheltering during extremely cold weather or during the inclement weather that we just had. And we want to share some of those best practices and then try to figure out how we can replicate it in other jurisdictions.
My name is Kathleen Conley. I'm a Senior Emergency Planning Coordinator with the Office of Supportive Housing. It's a relatively new position with OSH, and throughout the pandemic and a few other pieces I will talk about during our slides, OSH has taken a very significant role in the county's emergency preparedness and response. Before I dive into the slides, I just want to say thank you. I want to say thank you to Cadre for bringing people together for these educational opportunities where we get to share, we get to ask each other questions, and always learning. Every incident has similarities as far as how we respond in the structure of setting up an emergency operations center. Every incident has differences, and every incident has communication challenges and resource challenges. And, you know, we're starting to unwind from a very long, wet, soggy time and into now cold. So that makes it very difficult. Hang on a sec. Can you take this? It's Mike from Red Cross. That's the EOC calling. So it takes a lot of patience and resilience to do this work. And I just encourage us to continue building our relationships, because clearly going into this season with already having a couple of inclement weather activations, we were learning about that. We had the Emergency Operations Center bringing together on conference calls. We had service providers expanding their bed capacity really beyond, you know, way beyond normal operations. We have the teams working really hard at the Here For You hotline, and so many, all of you, you know, participating, stepping up and contributing to this effort where so many people were directly impacted by the rain and the floods. So I want to talk about our evolving role of the Office of Supportive Housing in emergency preparedness and response. And if you have any questions, feel free to use that feature. You can find it in reactions to put your hand up, and happy to take questions. We can also put questions in the chat. So going back to March, almost 3 years ago, everyone knows what happened then, right? Our world changed with a little virus called COVID-19, the pandemic response. OSH stepped up with multiple roles, including working in the Emergency Operations Center, which is downtown San Jose. Stepped up to manage, coordinate the Project Room Key, getting unsheltered persons into a safe and healthy sheltered place, and that was through hoteling. Also, for all general population, isolation and quarantine, hoteling. We operated the isolation and quarantine hotel. We were providing oversight and coordination with Valley Medical Center, the Valley Homeless Healthcare Program, medical folks, and working with the hotels and people that were placed in hotels, giving service providers guidance. We also participated in our Joint Operations Center. This is Linda's cell phone. Sorry about that. And let's go to the next slide. So just jumping to a little more recent times, it's hard to remember, but not, just a few months ago, we were in that extreme heat. And while it's chilly and wet, it's hard to remember that it was blistering hot and dry. So we have in our county what are called emergency operation plans, and for specific hazards, specific types of events like these weather-related events, we have what's called a heat annex, extreme heat, and we have an annex for inclement weather that I'll talk about a little bit more. So we've collaborated and coordinated with Office of Emergency Management for these stakeholder communications, calls that some of you might be on, but not all of you on. They're focused on with our first responders, with our local jurisdictions, the cities, the towns, National Weather Service, PG&E, and Valley Water. We have conference calls to talk about the situation. So we developed what's called a Common Operation Picture, a COP. We were very active in distributing emergency waters and supplies. If I remember off the top of my head, I think it's 426 cases of water that we were able to, on emergency basis, purchase and push out with advocates and outreach teams to those who are homeless. You need to just go back one, thanks. And we also have the SCC alert messages. If you've subscribed to the SCC alert at texting bad weather to 888-777, you would be receiving short, like one sentence types of alerts regarding the weather. So if you haven't signed up for that, or if you have people on your team that haven't, please encourage folks to join that so that we can coordinate so you can get information as it's happening. Next slide. So I wanted to define inclement weather. Inclement weather is unpleasant, especially with cold, wind, and rain. And I think we've become very familiar with it. Next slide. So the Office of Supportive Housing, we coordinate our government partners, we work with our private sector, nonprofit, community-based organizations, volunteers to provide equipment, supplies, emergency shelter to unhoused community members. So this is to help plan, coordinate, and respond to save lives. Next slide. We all know unsheltered persons are at high risk for sickness, injury, and death. In the inclement weather and in the heat event, yes, OSH is focused on our unsheltered persons, but we also have a larger role now for the general population if there's a need for mass care and shelter. We know that unsheltered persons have limited, if any, resources, are exposed and much more vulnerable. And just by living outdoors on the streets, that lifestyle, there are multiple health issues that come along with that. So these are highly vulnerable community members when we have an extreme weather event. Next slide. So I wanted to share with you what the triggers that have come together, and we have this documented and we reference this. It is in black and white, but I want to share with you that we at OSH are more flexible than rigid kinds of documents. We don't have to adhere to that. If we see some combination of these hazards, we're going to stay in our inclement weather activation, or we're going to activate because we anticipate some of these situations happening. So even though today is a relatively blue sky day, sometimes on and off a little bit, we are still in an inclement weather activation because our overnight lows are going to be hitting the lows, even as the skies have cleared. In fact, it's because the skies have cleared that we don't retain that heat that we had. So we look at our National Weather Service forecast. We also look at Doppler. We're looking at different websites. We're cross-comparing the different forecasts. And when we have an overnight 40 degrees or lower with a probability of rain, it's going to be at least 5%. That doesn't mean it's pouring, but if it's 40 degrees or lower, that's an activation. Overnight 45 degrees or lower with a probability of rain 50% or higher. So that means, you know, the temperatures are mid 40s, but pretty sure we're going to be getting some rain. And of course, the colder temps with the rain, you know, come together and create situations leading to hypothermia. When there's heavy, continuous rainfall, we're very familiar with that, over 2 or more days or weeks, or what seems like months, that would endanger the lives of those living outside, we're going to activate. The overnight lows could be 35 degrees or lower for 2 or more days without any rain present, such as what we're in a pattern right now. There may not be overnight rain, but we're getting into the low temps, and we may see some frost and freezing in different parts of the county, particularly Thursday, Friday, Sunday. Thursday, Friday, Saturday nights. So that is our, we're referencing this, we're sharing this with you so you can have an idea of what triggers the activation. And we will also take into consideration if there are other circumstances, like the ground is completely saturated, everything is wet outdoors, the situation we're in currently. Okay, next. So people exposed, I'm not telling you anything that you don't know. I'm stating the facts, I'm stating our reality. People who are exposed to the elements can get hypothermia, even when it is not very cold. Other aspects of the weather, such as wind and moisture, can cause the body to lose heat. People have a higher risk of developing hypothermia when using alcohol, nicotine, street drugs, and some medications. So in our messaging, and the messaging that we ask all of our partners, with housed and unhoused community members, if using any of those substances when there is a weather event, it increases their likelihood of their health being negatively impacted. Okay, next. So what is hypothermia? Hypothermia is a serious medical condition. It is a medical emergency that happens when your body loses heat faster than it can produce heat, causing a dangerously low body temperature. So normal body temperature is a range around 98.6, and hypothermia occurs when your body temperature drops below 95 degrees Fahrenheit. That again is a range. So individuals with other health conditions, underlying conditions may be impacted even more or sooner. People who are 65 and older or very young children are at a higher risk of hypothermia. Alcohol, drug use, and medications can increase the risk of hypothermia. Left untreated, hypothermia limits your nervous system from working correctly. It can cause complete failure of your heart, respiratory system, and it can even be fatal. So key piece here is when we have community members who are unhoused and perhaps there's another underlying medical condition, or perhaps there's some mental health issues and some cognitive confusions, what's happening with their body may be very, very, they're not accurately reading their own signs from their body. And although I've never witnessed this, there is a phenomenon of people with hypothermia actually disrobing because the body signals are so chaotic that they're feeling as if they're heated up when they're actually beginning to freeze down. Next slide. So I just want to share that picture is it was recently taken by a friend of mine who has deployed to Antarctica because it had a COVID outbreak, and he's working on that response there. So symptoms of hypothermia: confusion, dizziness, exhaustion, severe shivering. So it could even appear to be a type of a palsy or some other situation. The shivering is so intense. Shallow breathing, slurred speech or mumbling could have the affect of someone who's under the influence of alcohol or other substances. Progressive loss of consciousness, so maybe kind of fading in and out. Again, perhaps looking like someone who is under the influence, a weak pulse, clumsiness, lack of coordination, drowsiness, or very low energy. Seek medical attention if you experience these symptoms. And I think when we look at these symptoms, we can just see how confusing that might be to someone who's observing an individual experiencing hypothermia, that we might confuse it with something else that's going on. And there may be multiple conditions that are actually going on. So not simple, complicated. Next slide. So we convene these stakeholder calls. I want to thank all of you that have been showing up. We've discontinued the every day at 1 o'clock, touching base with service providers and our outreach teams and volunteer advocates. I do have a standing meeting at noon that continues. And we had set that up this year. We learned from our previous experiences like 2017 and even last Christmas season, where it rained pretty mercilessly for, I don't know, a week or 10 days. So we set that up and we developed these relationships so that we can communicate with each other and find out what the resource needs are, see how we can meet those needs, and that people are getting information on the direction that the county is moving and what the data is telling us about the weather. So we put together these situation reports. I share either through email and or through the SCC alert. We have the feature that is a text as well as being able to send out an email. And there's a link with these slides and we can perhaps share them with folks that is highlighted because you can find information, current information on cold weather from that website of the Office of Emergency Management. So again, sign up for your SCC alert by texting bad weather to 888-777 so that you can receive those alerts. Next slide. So the OSH crisis response team consists of myself, Linda Jones, and the lead for our team is Michelle Covert, and most of you know all of our team players. We have a newer responsibility for the entire county, all general population, for mass care, shelter, and emergency assistance, which means everything. You have seen the city of San Jose do an outstanding job in standing up their evacuation centers, those shelters for people that were mandatory evacuated and an unhoused population. So very, very challenging to do that work. But the team will do things like I monitor the weather. I communicate to the other team members if we're seeing something that might potentially be coming. We let our OSH leadership know. We develop and disseminate a safety plan so that all of us, all of you, need to always be thinking first, and I can't stress this enough, our own health and safety. And we're going to be having, some conversations with the EOC. We might do something called a hot wash, which is basically a debriefing. We look at after action, the areas where we had strengths, the areas where we can improve, and how we can go forward. Yeah, sorry, B. She posted she's having connection issues. So we have a continuous process, quality process improvement, and looking at what we've done and how we can improve. And, there are many things that we can improve upon during this flood incident, but it's still, it is still ongoing. The EOC has not deactivated, and the inclement weather that was generated by OSH, I think even before Christmas, I think it's just been ongoing. And we're hoping maybe Monday that we'll be able to say we are out of this weather pattern. So thanks so much for that. Rick has posted the link to the Alert SCC. So before I close, I just want to share a little bit about this actual activation. The County Office of Emergency Management has been leading a county-wide response and coordinating with all the local jurisdictions. It truly has been all hands on board. We work through weekends, we work through holidays. I'm really grateful for the OSH leadership that has looked at our role here and have, made sure that our team members get some balance as far as shifts, and so that we can stay resilient and that we can stay strong and we can stay healthy. Otherwise, we're not able to help those that we're serving in the community. So that has been really wonderful. The OEM has been incredibly supportive to looking at the sheltering needs and meeting resource requests, which can sometimes include staffing, such as behavioral health staff, to work at the evacuation centers with the city of San Jose. And we have worked with the American Red Cross, and I can't say it enough. If I've already said it, I'll say it again. They really have stepped up and done a tremendous job in managing the shelters and staffing the shelters. A lot of people have volunteered, to all the volunteers, to the cadres, to all of you that have done extra hours or been on call. And I know myself, I was dressed up for a New Year's event in Stockton, but I was on an operation area call at 6 p.m. on New Year's Eve, and staying in the loop and communicating. It's a big lift. It's a big lift, and yet we do get to save lives. When we've had the coroner's report out, there was maybe recently 2 deaths that still under investigation, might be connected with the inclement weather. But I think most of you know that we have gone through this season with relatively fortunate. We have lost some community members to the elements, but relatively fortunate. And all of this pre-training conversations, thinking, educating ourselves, educating our families, educating our staff, and people having an awareness in their own preparedness plan. As we build that and it becomes a way of life, we do build the health and safety for all. So that's all the time I'm going to take. I'm actually very happy to answer any questions that folks might have. And I can also, put my email in the chat, and would be happy to hear from them. Thank you.
Thank you, Kathleen. Any questions for the Office of Supportive Housing? All right, yeah, we're happy that you're part of this conversation and that we'll just continue the dialogue. If someone is not on your list of service providers or outreach team, Kathleen, is there a way they can reach out to you?
Yes, please. I just put my email in the chat. And if you send me an email, then I will, with your request and what you would like to be getting for information, I can make sure that we get you into the loop. Again, text the word bad weather to 888-777, and that will get you involved in that list for alerts. We try to send those sparingly, though.
Yeah, thank you. Okay, so Kathleen had shared this with me, and I put it on our website already. It is a document called the Point in Time Report, and it's done once a year. The new one is, the survey is happening this month. It's my understanding, and I just wanted to share this piece of it. It's about 50 pages long, and there is so much interesting information in here. But the one thing that I wanted to highlight is that the number of the homeless population that we have in 2022, we had 10,000. And Kathleen, how many shelter beds do we currently have in Santa Clara County?
I only have an approximate. I believe we have somewhere, thought it was 2,500. I can check on that. And we know with our counts called the point in time PIT count that we have well over 10,000 unsheltered folks. That PIT count is scheduled to take place again in January, and we'll see how those numbers are looking. So the available beds for those that are unsheltered, clearly not a match. However, there are also unsheltered persons who are not desiring to be in a congregate shelter.
Yeah, thank you. And there is in the PIT report, there is some of that is highlighted too, the reasons the people are unhoused and whether or not they even have an interest. And then I also wanted to share from that same report the number of unsheltered in 2022 by city. And obviously San Jose has the most with almost 5,000, but everybody has some. And so, I mean, Morgan Hill has 60, and they're going to present today because they have an overnight shelter for their 60. So for the other jurisdictions, we're hoping we can help come up with some kind of a solution so that it's not just so that not everyone's opening shelters at the same time, but there can be a little bit better way to get people inside without busing them all to San Jose. I'm gonna go ahead with our live presentations now. So City of Morgan Hill, Rebecca is on, and she doesn't have a PowerPoint. I just put this slide up as a placeholder, and I guess I could just leave it there, Rebecca, while you talk.
Sure, no problem. Good morning, almost good afternoon, everyone. It's good to see you here. No PowerPoint from me. I'm just going to walk you through how we started. Quick correction, we don't have 60 beds of shelter. I'll tell you what we do have. So a couple of years ago, through partnerships, everything we do in Morgan Hill is really through our partnerships. A lot of support from the County of Santa Clara Office of Supportive Housing. So I know Linda's on this call, Kathleen's on this call. So here's how it works on the ground for us. We got together with our faith-based community and our police department. Everybody wanted the same thing. My housing team, I'm joined here by Christy Thomas. She's our housing coordinator. And Brian Malikdam, he's our housing unhoused outreach specialist. We actually call him an unhoused specialist. So his job is to work with folks on the streets and go to them and outreach and build relationships with our unhoused community members. That's his job. 365 days a year.
Well, since we have a moment, I thought I would chime in here on what you were talking about, Kathleen. When people are very severely hypothermic and they think it's too hot. Sorry, Rebecca. It's called paradoxical undressing.
That's
all
right,
I wanted to share.
Paradoxical undressing.
I'm back, you all. My apologies. I'm going to jump back on because I also have to hop off right at 12. Sorry about that. My little 3-year-old sometimes makes her way in here. Usually not when I'm presenting, but here we go. So the way it works for us is we partnered with a church. They were kind enough to let us use their building. They host other meetings in this building, AA meetings, NA meetings. So we have to very much work around their schedule. I have a very small team, as I mentioned, Christy Thomas, Brian, and myself. So the way it works is Linda's team lets us know via email, Office of Supportive Housing says, or Michelle Covert says, hey, cities and county, we're expecting inclement weather. So then my team says, okay, let's follow our process. We contact our church partner and say, are you guys willing to open up for the next 3 days? Or this particular episode has been the longest we've ever stayed open, but this is all pretty much volunteer based. So the church 99% of the time says, yes, we've gotten our volunteers. We're ready to open the doors. We, the church, are ready to set up our cots. We actually only have about 12 beds. We typically say 10, but we can go a little bit over that. We have some extra mats and whatnot. So the church volunteers actually set up the shelter. My team, we call security. The city has a contract with a security guard. We have security there every single night that we open up the shelter from 7 p.m. to 7 a.m. So that's really the city's role, is funding that security guard contract. That gave the church some confidence to also join this partnership with us. We also have another contract with a local community-based organization called Compassion Center. They help support check people in. If they cannot attend for any reason, then my team will step in and we'll check people in for the first hour or so until the security guard knows kind of the flow of things. The most people we've ever actually had at our shelter is 6. So we've never, ever filled the shelter up. We then let all of our partners know, okay, we're going to open up for the next 3 nights or 4 nights. Here's our hours. Here's our location. When we first started this process, we were very shy and a bit nervous about getting more people than we could handle because we never did this before. So it's taken us some time to build some confidence. We've gotten a lot of support from the county. But now we let everybody know when we're open, including the Bill Wilson Shelter Hotline, the hospital system emergency rooms, all of our partners, and we still have never filled up during that time. Sometimes people will say to me, oh, but is it worth doing it if only one person shows up? My answer to them is yes, absolutely. We have done our job. We're doing as much outreach as we can. Brian literally goes out on the streets, drives around, walks around, and lets our unhoused community members know. In the episode, he gives them a flyer. Here's where to go. So we're starting to see more consistency, but we've been doing this for a couple years. So again, even if it's one person, it is absolutely, if I'm that one person, I want you to open up a shelter when it's freezing. So I tell people it's still our job to figure it out. Let's just do it. Okay, so then we have the volunteers covered, the cots set up, security guard fortunately, they've always said yes and always shown up. That would, thank God. Compassion Center is our partner that checks people in. When we can, we like to also do what we call a vulnerability index assessment for our unhoused to make sure we get them into the larger homeless database. If we have the capacity to do that, we take the opportunity to do that at the shelter as well. But Brian also does that out on the streets. And so, if we don't catch him in that moment, that's okay. Our priority is to get them indoors and essentially save lives and prevent the hypothermia that Kathleen went over earlier. So that's it, 7 p.m. to 7 a.m. The volunteers from the church also go the next morning and do the blankets and the washing of blankets and pillowcases and that type of thing. So what the city paid for, what continues to pay for, is Compassion Center contract to check folks in. Again, the security guard every single night. It costs us about $1,500, $1,600 to open up. There has been instances where we have not been able to open up because we couldn't get enough volunteers or we just couldn't bring all those details together last minute. The challenge for us in doing this is it is always kind of a last minute thing. You can only plan for weather so far in advance, right? So when it happens, when we get that notice from County Office of Supportive Housing, Michelle Covert, Linda Jones, we hustle and try to figure it out at the local level. I think that's us in a nutshell. I'm happy to share our information with you via email, kind of just highlighting what I just went over. I think I wanted to take any questions if folks have any questions for us.
I see one in the chat. Is there food provided at the shelter?
There is not. Initially, when we started this, we're like, oh, let's make sure we have hot tea. Let's make sure we have at least a cup of noodles, something. That all really depends on volunteers and that capacity. So when we first started out, I noticed, we had hot tea and we were a little bit more fancy. As it has evolved and we realized, what, we're a really tiny team. We don't always have the capacity to do all of those extra things. We don't do it if we don't have the capacity to do it. And it depends on our workflow and our workload. And, all 3 of us have to do EOC meetings. And so it really just depends. It is not our number one priority, but it's a goal. The number one goal is to open the doors and get them in off the streets.
Yeah, and that's great. And thank you for everything that you're doing. The vulnerability index assessment, was that you do that in-house?
We do now. Brian was actually we just joined the county's formal system as a partner agency that actually gets to conduct this assessment. That's a process you have to go through with the county's Office of Supportive Housing. So yes, we do this in-house now.
And is that, Kathleen, is that something that others could join to increase the number of people that could do that?
Sure. If you want to learn more about that, and something else is called VI SPDAT, which is basically an assessment tool for those who are unsheltered. you can certainly reach out to me, Linda Jones or Michelle Covert. I'm the one who's actually sending the alert messages these days.
Oh.
So it's me that's bothering you, Rebecca. Yeah, and we'd be happy to connect on that. And there are different trainings that happen throughout the year, you know, based upon need. So please reach out to us, and we can certainly assist with that. If I can, I want to take a minute here because Marcia and I were chatting about how important it would be to get together, and Cadre does a great job with these webinars, seminars. And I said, listen, let's reach out to Morgan Hill because they are my rock stars. Brian, Christy, Rebecca, the work that you're doing and the spirit with which you're doing it is a model. And that's what I think that we have to offer here. A very, very small community with very limited resources has figured out something that's not really that complex, to partner with a community-based, faith-based organization, to partner with, you know, other volunteers who are more experienced working with unsheltered folks. Is just, you know, remarkable. And there are other jurisdictions, every jurisdiction. So the county's a jurisdiction, which means except for those who are unincorporated. And then each of the cities and towns, those are jurisdictions, and every jurisdiction has a responsibility for their community members, housed and unhoused. And that is to provide emergency shelter resources, right? So, you know, we've seen City of San Jose step up with obviously, you know, a huge lift for the numbers of unsheltered. And we've seen Morgan Hill step up for lower numbers, but to meet those needs with the spirit of, you know, we're saving one life tonight, we've done our job. And I think that that model is something to be applauded. We may not be able to get you on CNN, but you should be, because this is the type of stuff that is really happening in our world with people in government and nonprofit and communities and volunteers coming together and pooling these resources. Like, we don't have it all, like OSH doesn't have a lot of resources. When I talked about being able to give out equipment and supply, those are equipment and supplies that have been donated. So we don't have a budget for that. And your communication, your team's communication with OSH so that we can stay in the loop and connect us with the Here For You hotline, 408-385-2400. Get a call in for an inclement weather bed because they are available. Your collaboration with that is remarkable. And I just, again, I have pom-poms that are just, you know, flailing all over the place here, and a megaphone, and can't emphasize enough just how amazing your work is, and that you're, you know, you're available. We brought you here so that other jurisdictions that have been afraid or don't think that they have the resources, or we don't know where to start, you know, how do we do this, can see that your team has accomplished this. So kudos. Thank you.
We're very grateful for your kind words. Thank you very much. We rely heavily on our partners, but really once you kind of establish those first, you know, 4 or 5 key partners, then you get into the rhythm of it. So if I can give you confidence to just start, even if you can only get 5 beds, 8 beds, you know, 5 safe parking spaces, don't be afraid to start small. It will grow, and you will build the confidence within your community, within your council, within your internal staff. So if you need any guidance from us or lessons learned, or want to meet separately, sometimes it's easier and more comfortable to just do the small group with the city, please reach out to me or my team. My email's in the chat. I'm happy to support you and kind of walk you through in more detail. And I'm happy to send you our shelter rules. That's kind of the one thing we make sure folks sign when they enter our shelter. So yeah, we are available to support the entire county in doing this. I wish every church could do it. And thank you for your kind words.
Yeah, thank you, both of you. All right, just trying to get us, get you all the information we wanted to share, even with all of the glitches, and B was not able to stay on the phone or on the call because it just wasn't working. And so I'm going to just bring her slides up just so that they're part of the recording. And there's only a couple of them, but just to share the information, if I can get it to. Well, maybe I can't. We'll just do this then. So I love this owl overnight warming center, because that's when owls are up right at night. Whoever thought of that, good job. But they don't admit minors, so I'm not sure where families go, if that was a need. And we'll be following up with B to get some more answers. And they're open through the San Jose with a contract for the whole cold weather season. This is who's managing the sites. What the case manager's role is, what the resident coordinator's roles are, and then the OWL manager for both sites. The on-site support services, resident coordinators, operations and information referrals, case manager does individual housing plans. So that's nice to try to get them out off the street, safe sleeping. Oh, this is that VISPADAP. I was going to ask you what that was. VISPADAP.
That's the assessment tool that I referred to.
Yeah, so
Yeah,
I'd like
SPDAT. And I forgot
then
the acronym.
provide meals and snacks and a place and storage offered. And this was something I saw in some of their outreach materials, is that they have a locked storage area, because one of the obstacles to unhoused wanting to come into a place is that they don't want to leave their valuables behind and have them disappear. And so these sites have a place where you can drop off your belongings and get a coat check and come back for them later, but they're in a locked area so that they're secure. And I guess what's that? This is the last one. Just so that you can look at this later on the recording if you'd like to, and we will post all of the slides so that you can have them. Okay, any thoughts so far from the organizations on the call? Anything that your organization sees as a possible intersection with these with these owls? If it's is it something that's more health related? We had talked during the extreme heat about doing health assessments, or providing meals, or any other expertise, interpretation. And I know nobody wants to commit to that at this moment, but I'm just, or even if you have expertise from other places that you've worked, things that have gone well, or how it worked before. Just keep thinking about that. I'm going to, so City of Sunnyvale, Terry Silva ended up with a conflict this morning. What I have for you, she gave me her slides, but I can also refer you to the city council report that she did, which is a recording, and I was going to play the recording for you. It's about 16 minutes long. We do have time to do that, but I think I'm going to go through a couple of the other slides first and then come back to that in case people have to jump off. But know that the recording is going to be here, so if you want to watch it later. They did a full study on what it would take to run an overnight warming center for their jurisdiction and for the number of people that they have, and it's fascinating. It's very well done. And so for those of you that can stay, you'll be able to see that. But let me pop over to what else we've got here. Okay, So the needs of a shelter, it's got to be an accessible facility. You've got to have overnight staff. And you see Morgan Hill has partnered with a church to do that. That's great. Interpreters are needed at all shelters. And we're trying to figure out a way so that that could be like FaceTime interpreters instead of in person, so that folks aren't sitting for hours not using their skills, but that they are available if there is a need. Transportation to the sites, because when the sites are far apart, it's just harder to get folks to leave their things and go far away. Pet care. I believe the owls allow for pet care, and the shelter that is the overnight shelters that the Red Cross has been staffing. It's been interesting because it's kind of like an owl in that they have an unhoused population, so it's a little bit different than they have experienced in the past, but they do have a pet care area, and we're learning a lot on how to manage that area. But it also, volunteers could be very helpful to the whole sheltering process in the county if we continue, and we will continue to get animals coming into shelters. We don't have enough city staff, county staff to run pet shelters, and we know that there are people in the community that would be more than happy to run pet shelters and pet dogs and cats all day. My daughter is one of them. A secure place for belongings, which San Jose's OWL has done. Behavioral health services, particularly to make sure that we're giving people the treatment and the help that they do need. Nurses for health screening. Can anyone think of any other services that you think should be made available? And my chat disappeared. Where'd it go? Okay. And no one's put anything yet.
Should we add storage? Marcia, should we add storage to this list?
Well, yeah, I put a secure place for belongings. So yes, the storage would make sense. Yeah. Anyone else?
Marcia, this is Norma. Let me get my video
Yes,
back
Norma.
here. I'm wondering, well, since we know and it's kind of been established that there's not food, there's not a budget available, is there anything that's provided to these folks? Because I would imagine they're away from home. They're not bringing food with them. What do we do? What is done?
Actually, I'm not sure where San Jose gets their snacks.
Can I, Marcia, can I just say that at the shelters with the Red Cross, we have Martha's Kitchen has offered to come in and serve all of the meals. And they've been doing that almost since the beginning. And from my understanding, I spoke with Bill Lee there to arrange the shelter food. And I believe that almost anybody could call, that they would be happy to come to these owls and bring food too. I believe that because he said anybody could call and ask for food, any organization.
Yeah, thank you. And of course, there would end up at some point being a bandwidth issue there if everyone wanted to do that. And there are other organizations that provide meals. So, and maybe it's a funding issue too, because that's not part of their budget right now, is to do additional meals. But that's all part of the conversation, and we want to continue to have those conversations to see what we can do to improve this. There will be a survey when I don't exactly know how it works, because as I'm running the meeting, I don't ever get to see that end user experience, but you're supposed to get a survey. One of the questions is, do you want to be part of future discussions? And so it would be very helpful if you filled the survey out. So just to help us inform our planning, are there overnight shelters in other cities that anyone on this call is aware of? Even if they're little, even if it's, it's 6 people like Morgan Hill did. if there are other efforts out there.
Well,
And people
I
are,
am aware of course, Morgan Hill, City of San Jose, and that another community, I believe it's Milpitas, has some emergency hoteling available. But that does not necessarily mean that it's an inclement weather that those are used, because we have, as we know, our unsheltered folks, it's an emergency situation every day. Funding is set
Right.
for that, and then there's a different level of funding, and there have to be certain triggers to access what's considered the emergency response, such as these floods. And I do believe the city of Milpitas did hotel a number of unsheltered persons to get them to a safe place. And there have been discussions at other local jurisdictions, city, town level. But as far as I know, I didn't hear of any other shelters open for this recent event. I see Brian has
Okay.
his hand up. Thanks.
yeah. And I was just wondering if any churches do this. I know some have in the past. I'll have to do some more research to see if we can find some more, just to kind of map out where all the support is and how we can support the support. Shelter challenges. So if you're a city, what are the challenges to shelter operations? And in the recording that Terry Silva made, one of the big challenges was that they don't have the expertise to run a shelter and work with the unhoused. And so that's obviously that could be trained, but maybe there's a better way to do it. And then from the nonprofit standpoint, what would be the challenges of supporting an overnight shelter? Or are there volunteers that would do that? Right, now that question is sunk in, who else should we be talking to as part of shelter discussions? Who's not on these calls that we need to invite to the next one?
Marsha, I'm going to jump in and be a little bold here, because, you get to a certain stage in your life and you just need to say it as it is. I think
Sure.
we need to engage with, especially every time there's an election and new elected officials, on their roles and responsibilities around emergency preparedness, response, and resources. Because the budget makers are also the policy makers, right? There's an old expression that your budget is your policy, because you put your money where your priorities are. And I think when we are able to have more conversations with elected officials, who run for that office, sometimes it's, a completely volunteer position, unpaid or whatever, and have that knowledge that there are responsibilities that do come with a cost, and what the role of each local jurisdiction is and how that interfaces with the role of the county. So the county is responsible for the unincorporated, that's our local jurisdiction. And each local jurisdiction is responsible for their own community members, housed, unhoused, and in a perfect world, there would not be a differential in how those populations are treated, but they are treated differently. And we've seen that in this recent flooding situation.
Mhm.
So having that kind of education, having this dialogue, bringing that back to our own local Office of Emergency Services or Office of Emergency Management, ensuring that there actually is funding for those staff, so that there are people that are trained and able to provide that guidance when incidents happen. And maybe even more importantly, before an incident happens, right?
Yeah,
Because
for
I'm
sure.
really firmly convinced, and still relatively new to this county in this work, really firmly convinced that the good relationships and the partnership building and the collaboration, like you and us here, and all of the folks are on this call, that really builds our capacity and our ability to respond and to save lives. So I think that is an area where we could pursue having people at the table. Maybe presentation. Cadre does such a good job with these that we invite elected officials and look at, look at the government code and where the responsibilities lie. Because I have been an elected official, and it actually was how I came into this work. When I found out that those floods, and I was responsible as the chairperson of the Board of Selectmen in Colonial, Massachusetts, that we needed to make these decisions. It opened up a door that I had not even known that was something that was going to be my responsibility when I was elected. So let's maybe explore that. It could be a lot of fun.
Yeah, let's do that. And I do, the last question I put down, would a countywide shelter plan involving all the cities be helpful? And I think you just said it, we've got to have the dialogue jointly. And if there is a way to share resources to make the sheltering more successful, that's our goal, is to maximize the use of scarce resources and still be able to take care of everyone that we need to. So we'll keep pressing on. Okay, before I show this video, the next webinar is next week on January 25th from 1:30 to 3:30. It'll be facilitated by Francie Collins, who's on this call, and it's under the radar, hidden obstacles to disaster relief. And it's just going to talk about the things that we just that aren't obvious, that may be impacting portions of our community, and how we can make sure that everything that we do is inclusive. And then remember that this survey will be coming on in a minute, and I'm going to share this video, and feel free to stay on and watch it. It is really good. She did a really good job on this study.
Good evening, Mayor, Vice Mayor, and Council members. Terry Silva, Assistant City Manager. So as the Vice Mayor mentioned, I'll be discussing study issue OCM 22-02. This study issue was ranked number 2 at our February 2022 workshop. Staff has worked over the past several months with the county, nonprofit agencies, and city department representatives that are impacted by homelessness in Sunnyvale to prepare this presentation. Department partners include the Community Development Department, Library and Recreation Services Department, Department of Public Safety, Department of Public Works, and the Office of the City Attorney. A little bit of background on the unhoused in Sunnyvale. The county just today released the 2022 information on the homeless population. The data in January of 2019 identified 624 people in Sunnyvale were experiencing homelessness. Today we received the data for 2022, and there are 385 homeless. Of the 385, 106 were identified as sheltered and 279 unsheltered. Just for background information, the county total for homelessness is over 9,000 for both sheltered and unsheltered. Next slide, please.
Oh, and real quick, oh, there it is. I was just gonna say, I wasn't sure if we were supposed to be seeing a slide before, just confirming.
Yes, this is the next slide. So I wanted to talk about the key elements of the study as it was presented to the council at the last study session. So we focused on criteria for operation, triggers that would determine activation, identify what resources would be necessary, services that would be required, identify and designate city department and staff that would manage the program, identify potential locations, allocate funding source for both pilot and ongoing operations, and then finally a communication strategies to include neighborhood outreach. Next slide, David. So in preparing the presentation, I looked at two models of operation, cold weather conditions and then operation during specific months of the year. The first option is only open during cold weather conditions and when activated by the County Office of Emergency Management. One concern, which is significant, is the city does not have staff on standby to respond to inclement weather conditions as they are activated by the county. Home First, based on my research with them, would not be able to operate on what I call a pop-up event. Now, this is only one nonprofit agency, but I understand the limitations of trying to get resources available on a weekly basis. Therefore, another suggestion for operational purposes would be to have a warming center that operates during the cold weather months, for example, November to March. It also is suggested that if we had a warming center, it would operate in the evening hours. For example, hours of operation could be 7 p.m. to 7 a.m. or 8 p.m. to 8 a.m. Whatever we found would be sufficient for our community. Next slide, please. So we looked at resources that are necessary for a warming center. We would need to purchase supplies such as mats and blankets and potentially pet kennels for the first year, and we'll likely need to store and reuse these supplies in subsequent years. Other resources necessary would include the purchase of food, contract out daily cleaning. We would need to be prepared for any participants who bring animals, which is the kennels, and also pet food. We will need to rent storage facility for participants to store their belongings while the shelter is operating. We can anticipate that we will receive donations from the community and we'll need storage for any donations that may come in. Finally, we will want to consider wraparound services for any type of warming center, whether it's pop-up, seasonal, in-house staffed, or contracted. There will be need to have some kind of wraparound services for adults, families, children, and services would address areas of either mental health, medical, crisis care, or case management. So we just wanted to make sure that we go in fully aware of the impact of additional resources for a warming center. Next slide. So services required. We would require to have staffing for the warming shelter and also case management services. For staffing, we will need management support, overnight staff, which would include starting the program in advance of the shelter opening to provide staff training. We will need to hire security guards for the facility. In providing programs such as shelters, it also requires the support of various departments, which include public safety, the Office of the City Manager, and various other city services. Case management would include the selection of nonprofit partners. We would need to rent portable shower facilities, laundry service, and the potential for medical and other wraparound services. When you partner with a nonprofit agency that provides services in this area, they are a great resource for locating the medical and other wraparound services to assist the unhoused population. For example, getting individual Social Security benefits, Veterans Administration appointments, dental appointments, or other additional services that may be available. This is similar to what we did with the Fair Oaks Motel program, and it's very valuable for the population that is utilizing this service. Next slide. So we also wanted to talk about city department for operation. And if we want to provide homeless services by the city of Sunnyvale, I think it's important to consider a permanent position. If the city was to operate the shelter, we would need to hire management and support staff for approximately 6 months. This includes time to prepare the facility and train staff for operation. In addition, we will need time for the recruitment process. And this is in consideration of a model that would be open 4 to 5 months during the cold weather season. Staffing alone for city-operated services would cost over $20,000 per month, and this does not include the case management services, security, or the cost to provide other infrastructure for storage, showers, etc. We can anticipate costs to be similar to what San Jose pays for security, which is $60,000 for 5 months of service. In addition, we will need to contract for case management and for something similar to what we have with Home First. That would probably be about $14,000 a month for having 2 individuals providing case management services. As an example, Home First manages the warming centers for the city of San Jose, and I am aware that their services in this area are based on my conversation with their leadership. The cost could be similar to using internal staff, but Home First, or a similar nonprofit, has the experience and knowledge in operating this type of facility, along with relationships with providers for the wraparound services. Next slide. So as I mentioned earlier, contract services is a model where the nonprofit agencies already have programs in place, and they provide the expertise and training to provide the best service to the homeless population. Because agencies such as Home First have this program in place in other cities, they know what it takes for the program to be successful. They have the relationships with the county and other nonprofit agencies and can provide case management to the individuals utilizing the shelter. We believe this model will be approximately the same as providing services with city staff and have the least amount of impact on our current areas of service delivery in our community. I wanted to provide an example of what the city of San Jose provides using Home First. They budget 180 days, which includes training days, so their facility is open for 5 months or 151 days of operation. And this allows for staff training on the front end. Currently, Home First provides service for the city of San Jose at 2 sites, serving 60 individuals, with 30 at each location for about $790,000. This does not include all of the core equipment like mats, blankets, etc., because those were previously purchased. But it does include 5 months of service, 2 staff on site, security the entire time, case management at each location, and in addition, San Jose includes some additional financial assistance for its participants. In speaking with Home First leadership, they explained that a pop-up model is difficult to staff and therefore is not likely to get an agency interested in serving Sunnyvale with that model. Based on this conversation, staff focused more on what it would take for a longer-term shelter model. Next slide. For potential locations, we currently don't have a private site available that would work. I requested our Deputy City Manager for Economic Development to identify any locations, and she found a warehouse site that is currently on the market, but it's 1 large room. The site is 11,400 square feet, and the asking rent is $2.10 per square foot. That's $23,940 a month, or $287,280 per year. For us to use a facility that we don't currently own, I'm not sure if we could lease something for 5 months, and if we were, it would likely not be available the same time the following year. So the council would have to make the decision to purchase a site or lease for a 12-month time period. And this would be an additional cost to a city-provided program. So we also looked, next slide please. We also looked at potential locations of a current city building. So we considered multiple locations and recommend Washington Park Building. Now, in working with our Library and Recreation Services Director and her staff, it was determined that this was the best location based on the size, layout, and features provided in the building. There is a kitchen area. We have 2 rooms in the building. So if we needed to separate the participants, we had that capability. It has bathrooms on the facility, and the location is central to public transportation, the library, the Civic Center campus, and downtown Sunnyvale. The Washington Park building does have approximately 103 rental reservations from now until February to demonstrate an example of how the building is currently used. And we would need to communicate with these participants if they were to be displaced to another location. And I wanted to provide just a couple of examples. We have the Santa Clara County Registrar of Voters that is using this location daily from October to November. We have Silicon Valley Women Alliance, twice weekly reservation on Thursdays and Fridays from October to February. We have the Way Gospel and with a weekly reservation on Sundays from October through February. And we have our Cub Scouts with a monthly reservation on Mondays, October all the way to December, currently reserved. Next slide. So we looked at funding for both a pilot and ongoing program. We do have funding that could come from the general fund or potentially CDBG, in addition to a potential partnership with the county. For CDBG funding, it can be used for both infrastructure and operations. However, operating funds have been committed to other programs and services, and if we wanted to use these funds for the warming center, it would be competing for the same funds that are already being used. In other words, you would have to unfund something else to fund a warming center when using CDBG fund money. Santa Clara County Supervisor Lee also submitted a referral to the Board of Supervisors to partner with the city for warming centers. However, at this time, we don't know what that means in regards to additional funding, staff support, or other. After direction tonight, staff will engage with Supervisor Lee's office and the County of Santa Clara to discuss what the partnership might include. Next slide. Part of our key strategies was to look at communication. We will need to establish a plan. We would recommend, as part of the implementation of a warming center, if the council chooses to move in that direction, that we develop communications plan that would require significant outreach, identifying areas of concern voiced by the community and the current users of the facility, and finally, an opportunity for us to address the concerns that were identified. We will need to conduct outreach with the community in the neighborhood before the plans are finalized for the warming shelter. In addition, outreach will need to occur with the unhoused community for their participation if we were to move forward. We would also suggest partnering with our unhoused advocates in Sunnyvale. Next slide. So options for consideration by the council. We could remain status quo with what we have now, which is nothing. We could have a pop-up warming center, although not recommended by staff due to operational constraints. It is an option. Or we could open a warming center for 4 to 5 months during the cold weather months. This model could be accomplished with city staff using both permanent and casual employees, or we could contract out with a nonprofit agency to provide the service for us. So finally, we get to direction to staff. Thank you, David.
Okay, so we're back and we're at the end. Just again, if you could please fill out the survey, and we hope to see you next week. If you have any questions or comments, you can reach out to us, and we will continue to have these conversations. We thank you to all of you that were participating in the call, and we will make sure with your help to share this recording with as many people as possible to try to get some momentum to create a more inclusive shelter experience. And enjoy the sunshine.